You know what bothers me? What the fuck is this?
You see it from a long way away. It's a person's face. So
What is it?
it's a really, it's a long story. But
No, it's a long body pillow.
I love it.
Hello! Welcome back to
What's Safeword?
I'm Am.
And I'm Bo.
And this week we're going to talk about
STDs.
which stands for
Sexually transmitted diseases.
or
Silly topical ducks. I really want a duck who comes up to me and he's like, quack, quack, sir.
But today we're going to talk about the STD that everyone knows it for, sexually transmitted diseases.
Yes. Quackback.
And so this week we're going to cover STDs, how you get them, how you can treat them, and just be a smarter sex-having person.
What's important to say is that all sexually active people are going to get an STD. Inevitable, we're sorry.
We did give it to them. Someone with an STD is not a slut. Someone that catches an STD just means that they, slept with someone that happened to have something that was not checked. And it's not any one person's fault, it's just something that comes along with having sex regularly. So shaming someone for getting an STD, having an STD, it's gonna happen. You are not better than that person. You are probably, in most cases, more boring of a person because you're not having as much sex.
Whoa.
So check yourself.
Quackback.
What is a quackback?
It's a clapback, but for ducks.
We're gonna talk about the most commonly contracted STDs.
Ladies, here we go.
The first STD we want to talk about today is herpes. And herpes is something that 45 million Americans currently have. That's 4 out of every 5 people in America. And that's because herpes is so easy to catch and give. It's something that you can give skin to skin. It's very simple to just transmit it.
I have herpes now.
What are you trying to say? And there are 2 strains of herpes out there. There's HSV1 and HSV2. Generally, HSV2 is the culprit for most of the herpes that exists out there.
Chances are that if your mom kissed you when you were a kid, you have HSV1.
Which are cold sores. So when they ask you where you got it, I got it from my mama. And the absolute most contagious parts for herpes are anywhere that have the blisters that contains the actual liquid of the sores.
You're the most vulnerable to spreading herpes when it's itchy and you don't see things.
And an outbreak is when you're having symptoms, and that's the visible symptoms of the actual blisters and sores with the liquids inside of them. Other symptoms can include swollen glands, fever, headache, or even muscle aches. And while the very first outbreak can last anywhere from a few days to a few weeks, it's said that in most people you don't see too many recurring outbreaks, and even if you do have recurring outbreaks, the longer that you see that you have herpes, the less outbreaks you get and the further and farther apart they actually are. What can lead to outbreaks is stress, not sleeping. Actually, a lot of sunlight can lead to herpes outbreaks, I've been told.
Biking, actually.
Biking?
Because you're sweaty.
Oh yeah, sweat, irritation, rubbing. And so it's really important to know that you need to take care of your body, but this is one of those STDs that is not curable. It's just something that retreats and retracts back into your nervous system of your body when it's not having an outbreak. And it's always going to be with you. You have it.
It's your forever friend. Gonorrhea is another common STD, and it's often called the clap, and it's often contracted with chlamydia. Quackback. It's contracted through unprotected sex, heavy makeout sections. Also, a mom can pass it to their child during birth. Symptoms can include unusual discharge from the penis or vagina, also burning when you pee, and rashes around the rectum and genital area.
Blech.
Left untreated, it can lead to infertility and pelvic inflammatory disease. The word puffy cooter came to mind.
Ew! Luckily, you can treat your puffy cooter with antibiotics and generally a shot to the hip or the butt. Chlamydia, and this is one of the most common STDs in the US and the UK actually, but it's also one of the more easy to cure. Like gonorrhea, chlamydia can be spread very easily through unprotected sex, and like gonorrhea, it also is an odd or unusual discharge and a burning when you pee.
Why'd you look at me when burning when you pee?
It's also treated with antibiotics and easy to cure, but always, always, always do a final 3-month later checkup just to make sure you're clear of it.
Syphilis, one of the oldest and sneakiest diseases. Ooh, it's the ghost of syphilis past. It's contracted exactly like all the other ones. Syphilis develops in stages, and the stages vary in time when they show up. The first stage involves painless sores in the genital and mouth area. And then the second stage, which can happen 4 to 10 weeks later, which can include rashes everywhere on your body. And in the final stage, 3 to 15 years later, you can contract nervous system diseases where it can infect the brain, the liver, the heart, the lungs. You could treat it with penicillin. It's pretty simple. It's an antibiotic.
The next STD,
Trichomoniasis.
because we didn't know how to pronounce it,
No.
infects more than 1 million people in the US and is a parasite that is contracted from one person to another. It can be transmitted from a man to a woman to a man, a woman to a woman, but I didn't actually see that it was something that was male to male that causes some burning when you pee. It's also said that some people have pain in the abdomen from the parasite. It's like alien. But it's very easily treated with just antibiotics. It's much easier to get treated than it is to pronounce the word.
Trichomoniasis.
Good. Sexually transmitted hepatitis is hepatitis B, or HBV, which affects more than 1.25 million individuals in the US. I bet you can't guess how it's contracted.
Sexually.
Duh. Half those infected with Hep B show no symptoms, but the other half actually have scar tissue on the liver, and sometimes that can cause liver cancer and psoriasis. It's bad. Other symptoms include muscle fatigue or muscle pain, yellowing of the eyes or jaundice, nausea, and a distended stomach. To treat this, there's a vaccine that you can easily get from your doctor.
HPV, or human papillomavirus. Whether it's oral, sexual, vaginal, skin to skin. It's another one of those skin to skin STDs that you have to be very, very careful about. Nearly every sexual person will have HPV at some point in their life. But the upside to that is that not all versions of HPV actually have symptoms. Many of the strains of HPV that exist out there just naturally move out of your system, your body gets rid of it, and there's no actual visual symptoms or aches or pains that go along with them. But some do come with some symptoms that can include genital warts, some warts or bumps around the mouth, in the throat. It can even cause some cancers in the cervix, penis, mouth, or throat.
Penis cancer.
For treatment, there are 3 different vaccines to help protect you against HPV. The CDC recommends that women from 11 to 26-year-old and men from 11 to 21 get vaccinated. Get your shots!
HIV, or human immunodeficiency virus, infects more than 200,000 people every year in the US. For symptoms, the virus attacks the immune system and it basically takes all the T cells that the human body has and destroys them. So you can't fight diseases.
And you get sick very easily.
There is no cure to HIV, but with medicine, treatment, and prevention care, a person which is infected by HIV can actually survive and live a long and healthy life.
And with things like PrEP, which you've talked about, is a great way to fight against it preemptively. And last but not least, the most dangerous STD out there.
Pregnancy. Baby virus.
STDs are out there. They exist. They can be scary. They can make you unsure of what you're doing. But the best way to combat and fight against STDs is to just get tested. We recommend that you get tested every 3 months, or when you have, maybe been exposed to something. Another great practice is just self-disclosing. Just be really communicative with your partners. People that understand and know what you're going through are going to be a lot more understanding in general, are just going to be easier people to have sex with and better partners for you in the long run.
And if you want a really good reason to get tested, go to Google Images and just search up any of the STDs talked about.
No, don't. Have you had an STD before?
Yeah.
How many? How many times have you gone to the doctor and had...
More than this many.
Jesus.
Hey! No shame.
How easy was it to get treated?
Oh, so done.
If you are getting into a new relationship and you're looking for something fun to do with your partner,
Go to the clinic?
go to the clinic and get tested together. Nothing says closeness like...
Good thing you don't have gonorrhea. Now we know. That's so romantic.
So don't forget, you guys, whenever you're having sex, to always have a safe word. And today's safe word is...
Peregrine falcon.
Because that safe word is foul.
Crack back. Share your skin-to-skin germs by pressing that like button.
And leave a comment if you've had a weird, fun, funny, interesting story around STDs, because we love to read and respond to them.
And don't forget to subscribe to What's a Safe Word, and we'll see you next week.
Bye! STDs should stand for so
Totally dumb.
dumb. So totally dumb. That's what they should stand for. STDs. We should make a shirt that says STDs. So totally dumb.
Yeah.
But, I mean, they happen, so.
Yeah.
That's what it should say on the back, though. But, I mean, come on, they happen. We've all been there. Want some HPV, come on over.
Let's make a shirt.
You know. High five for HPV.
Oh.